Thank you very much, Secretary of State. You've said that test and trace is vital to stopping the spread of the virus. We've heard reports from some contact tracers that since they started work in England last Thursday, they've had very little, if anything, to do. What do you think is actually happening with the system?
Thanks, Hugh. I'll say something and then I'll ask John to add to that. The system is up and running. It's successful. I'm very glad to report that those who are asked to isolate by the contact tracers are expressing the willingness to do so, and we track that very carefully. Now, one of the pieces of good news is that as the rate of incidence of new cases comes down, so of course there are fewer index cases to track, and we've hired, as you know, 25,000 people to work as contact tracers, and the level of incidence of disease has come down, and so actually we have more capacity than we need. This is a good thing.
Yes, thank you, Secretary of State. So exactly, the test and trace program is working well. The data are flowing from the testing portal into the contact tracing software, which is all have been built relatively new. So we're very pleased to see that all working well, and the contacts are being identified. There are different levels. There's the clinical public health level, which looks at more complicated cases, for example, those arising in care homes or in outbreaks of some sort. And then there are cases where people can, in fact, enter their own contact details on the web-based portal. So that doesn't require the intervention of one of the call handlers, the contact tracers. And then there are those who need to be contacted by the contact tracers, and there are plenty of cases and contacts being reported and being pursued in all three of those areas. So they are all working, and they're all working well. But as Secretary of State says, we do have a lot of capacity. We're very grateful for all those people who have come forward to work as contact tracers. And at the moment, many of them are not fully occupied, but we wait and see. One of the challenges, of course, of this is to build a system that can respond to whatever comes in the future. And that is a little difficult to predict. We think there will be flare-ups in different parts of the country, and we'll need to be able to divert resources as required. But we wait and see. But at the moment, it is working. It's working well.
Thanks very much.
Can I ask a follow-up?
Yes, of course.
Do you know how many contacts have actually been made since Thursday? Because with nearly 2,000 new cases each day, you'd have thought there would have been quite a lot of work for them to do, even with the factors you've mentioned.
Well, if you think about it, today the figures I announced today are that there were only 1,570 new cases, which is lower than when we were planning this system. And so I think to err on the side of having too many contact tracers is the right side to err on. And I'd rather have too many people trained and ready to go. We've got 7,500 clinicians in the system, which means that for every new case, we have, on average, 6 clinicians able to support them. And that also one of the interesting things is that the number of contacts that each index case has is a bit lower than we were expecting, which implies that people are following the social distancing rules and are not coming into contact with large numbers of people. But of course, that also reduces the demand on the contact trace.